This module is designed to provide a brief review of the Centers for Disease Control and Prevention's Advisory Committee for Immunization Practices, ACIP, hepatitis B vaccination recommendations, as well as cleaning, disinfection, and sterilization in healthcare settings. Now, there are a number of vaccine-preventable illnesses that can be spread within a healthcare facility. However, for the purposes of this webinar module, we will be focusing on hepatitis B vaccination. So the module includes information on hepatitis B vaccination recommendations for healthcare providers, individuals living with diabetes, and individuals beginning hemodialysis. Additionally, cleaning, disinfection, and sterilization practice standards will also be discussed. References have been included at the end, as this is not a comprehensive review of all vaccination recommendations and infection control practices.
Hepatitis B virus, or HBV, is a highly infectious and environmentally stable blood-borne pathogen. It can be transmitted by medical equipment contaminated with blood that is not visible to the unaided eye. Percutaneous exposure to HBV occurs as a result of assisted monitoring of blood glucose and other procedures involving instruments shared between persons. Lapses in infection control during assisted blood glucose monitoring that have led to HBV transmission include multi-patient use of fingerstick devices designed for single-patient use, as well as inadequate disinfection and cleaning of blood glucose monitors between patients. Breaches have been documented in various settings, including long-term care facilities, hospitals, community health centers, ambulatory surgical centers, private offices, homes, and health fairs. Since 1982, hepatitis B vaccination has been recommended for healthcare personnel, including personnel exposed to blood in long-term care settings. In addition to healthcare personnel, ACIP recommends that hepatitis B vaccination be administered to adults with diabetes who are aged 19 to 59 who have not previously received hepatitis B vaccination. For adults with diabetes who are aged 60 or greater and have not previously received hepatitis B vaccination, vaccination may be administered at the discretion of the treating clinician. Also, a recommendation for hepatitis B vaccination exists for persons beginning hemodialysis. Since the initiation of strict infection control practices and hepatitis B vaccination, the rate of HBV infection among patients undergoing hemodialysis has declined approximately 95%. Nonetheless, repeated outbreaks of hepatitis B infection among unvaccinated patients underscore the continued risk for infection in this population. Public health programs and primary care providers should adopt strategies appropriate for their practice setting to ensure that all adults at risk for hepatitis B infection are offered hepatitis B vaccine. Occupational health programs should identify all staff whose work-related activities involve possible exposure to blood or other potentially infectious body fluids in a healthcare, laboratory, public safety, or institutional setting, including employees, students, contractors, attending clinicians, emergency medical technicians, paramedics, and volunteers. Provide education to staff to encourage vaccination. Implement active follow-up with reminders to track completion of the vaccine series among persons receiving vaccination, and provide appropriate post-vaccination testing.
Vaccinations, in conjunction with meticulous attention to infection control practice, are key to preventing the spread of infections such as hepatitis B and C. Practice standards for cleaning, disinfection, and sterilization in healthcare settings are based on Spaulding's classification system. Healthcare devices and equipment are designated as critical, semi-critical, or non-critical based on the risk of infection involved with their use. These categories define the level of reprocessing, that is disinfection or sterilization, required for various medical devices. Contaminated surfaces increase the potential for transmission of bacteria and viruses between patients. The patient environment can facilitate transmission of bacteria and viruses by direct contact or hands of healthcare personnel. Cleaning is the removal of debris such as dirt, food, feces, blood, saliva, and other body secretions. Cleaning reduces the amount of organic matter that contributes to the proliferation of bacteria and viruses. Items requiring only cleaning are floors, walls, windows, chairs, and other furniture used by individuals who are clothed, private offices, and other non-public, non-patient care areas. Bed curtains should be changed when soiled and with terminal cleaning. Disinfection removes most organisms present on surfaces that can cause infection or disease. Disinfection is a time-dependent process, and healthcare facilities must use EPA-approved product for desired level of disinfection. Select disinfectant based on what you are trying to accomplish. For example, environmental disinfection versus medical device disinfection. Follow manufacturers' recommendations to achieve disinfection and avoid medical device damage. Be sure to use correct dilution, allow for correct contact time and temperature. There are 3 levels of disinfection: high, intermediate, and low. Non-critical items require intermediate level or low level disinfection. This includes items in contact only with intact skin. For example, blood pressure cuffs and stethoscopes. High-touch surfaces in patient rooms are considered non-critical items, but must be cleaned and then disinfected on a regular basis. Examples of high-touch surfaces include doorknobs, bed rails, IV pump, IV poles, telephones, TV remote, computer keyboard, toilet, and light switches. Semi-critical items require, at a minimum, high-level disinfection. This includes items in contact with non-intact skin or mucous membranes. For example, anesthesia equipment, bronchoscopes, and GI endoscopes. Keep in mind that the cleaning process, or removal of debris, must precede high-level disinfection. You cannot achieve disinfection or sterilization without pre-cleaning, since organic material dilutes disinfectants. Bioburden must be reduced for disinfection processes to be effective. Clean all medical instruments and devices as a first step. Sterilization is the killing or removal of all organisms. Critical items require sterilization. This includes items that enter sterile tissue or the vascular system, such as surgical instruments. Examples of sterilization include use of steam, dry heat, ethylene oxide, or peracetic acid. Steam sterilization is the most widely used and the most dependable method of sterilization. The basic principle of steam sterilization is to expose each item to direct steam contact at the required temperature and pressure for the specified time. Steam sterilization can be done using an autoclave. An autoclave achieves rapid heating and penetration. This allows for short exposure times of 20 minutes or less. However, temperature must be maintained throughout the steam sterilization process. Items to be sterilized must be clean and free of protein, such as blood or other organic material, and packaged so that the steam can penetrate. Additionally, the autoclave must be loaded correctly, so be sure to follow manufacturer's instructions for use. When using an autoclave, it is important to keep time and temperature logs, as well as use indicators to monitor effectiveness of the steam sterilization process. In summary, follow ACIP hepatitis B vaccination recommendations for healthcare personnel as well as patients. Disinfection or sterilization cannot be achieved without pre-cleaning, so be sure to clean all medical instruments and devices as a first step in the disinfection or sterilization process. EPA-approved product must be used in accordance with the manufacturer's recommendations to achieve the desired levels of disinfection. With any disinfection or sterilization process, be sure to use correct dilution, contact time, and temperature.
For thorough cleaning, disinfection, and sterilization guidelines and techniques, reference the CDC's guidelines for disinfection and sterilization in healthcare facilities. Also, for more information on ACIP vaccination recommendations and EPA-registered disinfectants, click on the links in the description box below. We would also like to thank the California Department of Public Health for use of their materials to develop the content for this webinar.